Hey everybody, just wanted to come on and do a somewhat short video of a new therapy that I'm going to try. For most of you that know me, you know that I've been very, very sick since 2006 when I came down with a really gnarly case of mono, and was up and down for a few years. And then when I had my daughter in 2010, late 2010, the bottom really fell out and my health just kind of steadily declined and has continued to decline over the years. And I had to stop working in the spring of 2012, and haven't been able to work since. So right now I carry a litany of diagnoses, which a lot of patients like myself carry. So a lot of acronyms. I have chronic Lyme disease. I have postural orthostatic tachycardia syndrome. I have mast cell activation syndrome. I have what they call chronic idiopathic dizziness, which means they just can't explain why I'm dizzy all the time. It could be from the Lyme disease, it could be from the mast cell activation. It's not from the POTS because it doesn't usually track with my blood pressure changes. I have ME/CFS, or myalgic, I can never pronounce it, encephalomyelitis, or chronic fatigue syndrome. I have a IgG deficiency, which at the moment is going untreated, it's an immune deficiency. And let's see, what else is probably on my list of diagnoses? Of course, severe treatment-resistant depression and generalized anxiety disorder, which those all developed and continued to get worse as I stayed sicker longer. And just generally on a day-to-day basis, I feel lightheaded, very dizzy, very unsteady on my feet, like I'm going to pass out at any moment, even when my blood pressure and my pulse are fine, or even a little high. I feel like I have the flu. I have a sunburn sensation all over my body. So if you've ever had a bad sunburn, I have that on my face, my arms, and my legs, and it's 24/7. It never goes away. Lots of cognitive issues, lots of brain fog, like I'm thinking through cement, or I can't think. My memory is really bad. My working memory is bad. Have trouble reading, have trouble concentrating, sensitive to lights and noise and movement. In general, my nervous system is just on a hair trigger. So things that would normally not affect a normal person, like the TV on and somebody talking at the same time, or being in the car, or trying to follow a movie. Those things make me feel sicker. So we've seen a lot of physicians over the years. I think at last count, we had seen something like 95 physicians. We may be upwards of 100. I mean, it's been over 20 years. It's 2006 was when I really got sick. The mono was what really kicked everything into high gear. But before that, I had some fainting spells as a kid, and through my college and law school years, and with my first pregnancy. So there was some underlying autonomic dysfunction that was there already, but the mono is what kind of like kicked the whole thing off. So we've seen a ton of doctors. We've spent an ungodly amount of money trying to treat all of the various diagnoses. We've tried a lot of unconventional treatments, and a lot of, I don't know if you want to put them in the non-medical category, things like brain retraining, brain rewiring, psychotherapy, neurofeedback. We've tried lots of things. You name it, I've probably tried it. And unfortunately, little to nothing has worked. Or if something works, it maybe works for a week. It makes me feel a little bit better, and then stops working. And we've seen some of the top doctors in the country. We're still consulting with some folks looking for and pursuing some really highly known, or I should say highly experienced, but not highly known, but highly experienced neurologists to double check if there's something structural going on, which I've had MRIs, I've had CTs, I've had transcranial Dopplers, and they all show a bunch of abnormalities, but nobody's putting the pieces together. So for the moment, what we're focused on is we've spent the last year treating with one of the top ME/CFS and complex chronic illness docs in the country, and haven't made much progress, if any at all. I'm on a lot more medications than I was, which is always an issue with mast cell activation. So we're closely watching that. But candidly, and he and I have talked candidly, he hasn't been able to get me moving in the right direction. So what are we doing now? We are going to do something called SOT therapy, which stands for Supportive Oligonucleotide Technique, or sometimes it's called Supportive Oligonucleotide Therapy. It's also under a new name called Q-Restrain, which you also might see bantered about lately. The lab that makes it has renamed it, but people for the most part are still calling it just SOT. If you look for it under the literature, you'll find it under something called antisense therapy. And what it is basically you get tested for Lyme disease, the co-infections, and viruses, which is what they can make an SOT for. And we all know the issues surrounding testing. So that's, something we can discuss in a later video, but you get tested, and then if you get a positive test, you take that positive test and you take it to a physician that does SOT. The physician will draw your blood. They draw a vial or two of blood. They send it to a lab called RGCC over in Greece. And then they take your blood and they genetically sequence the bug that you ask for. So for example, I test positive at present, and I still have some tests coming through, but at present I test positive for Borrelia burgdorferi, for Borrelia guarini, for Borrelia burgdorferi. So there are 3 strains of Lyme, for Babesia coli, which is a strain of Babesia, for Bartonella henselae. And we have a couple of tests that we're still waiting on to see if there are some additional bugs that might be there. So with this first round, we sent my blood off to Greece and we asked them to make an SOT for Borrelia burgdorferi and for Borrelia guarini. Borrelia guarini is a well-known cause of neurological Lyme. It's one of the most active spirochetes in terms of causing neurological Lyme and getting into the central nervous system. It really burrows in there. So it could be responsible for a good host of my symptoms. So the lab in Greece will take your blood, and so let's say, for example, for Borrelia guarini, they will genetically sequence Borrelia guarini, my Borrelia guarini, the one that I'm carrying, and they will find the portion of the DNA that will turn off its replication. And they will basically make an oligonucleotide, which is a small protein. I believe it's RNA. And they make that, they put it in a vial and they send it back to me. I go into my doctor's office and I get about a 5-minute infusion of that protein, that RNA. And then it gets uptook by my cells and by the Borrelia guarini that is swimming around in my bloodstream and central nervous system. It does cross the blood-brain barrier, SOT does, which is great. And then those Borrelia cells will slowly die off because they can't replicate anymore. So it turns off their ability to replicate. So you get a slow die-off process. So instead of antibiotics, where you get a hit to the bugs, if you can get to the bugs, because sometimes, we all know that they hide in various forms, in biofilms and cyst forms and things like that. This instead gets taken up by the bugs wherever they are and shuts off that replication, and then they slowly die off. So the advantages of it is that it's like a laser missile, and that it comes in and attacks a particular bug. And without harming, it doesn't do anything to my DNA. It doesn't do anything to the DNA of any other bugs in the system. It may, there's some controversy about this, but it may also affect, for example, if I take a SOT for Borrelia garini, it may affect some of the other Borrelias, but the information of that is kind of unclear. Is it affecting it because they're stopping replicating, or is it because you're lowering the load of that particular Borrelia, and then your immune system is taking care of the rest of the Borrelias, right? It's not quite known what might cause the decrease, because some people will take for example, a Borrelia burgdorferi SOT, and they'll see all their Borrelias come down, their numbers come down. But it's not clear whether that's because they're dying off, because they've also taken up that RNA and they're not replicating, or it's because the Borrelia burgdorferi was reduced so much that the innate immune system was able to take over and clean up the other Borrelias and get those under control. So, but in general, it only hits that one species. So it's a laser bomb. So you're not, for example, bombing your gut with antibiotics and killing the good guys and the bad guys. You're literally coming in with a laser bomb, which is great. But that's also a drawback, because a lot of us carry more than one infection. We know that I have at least 3 species of Borrelia that are apparent right now, 1 of Bartonella, 1 of Babesia. I could have more, so that's 5. Plus we know I have a very, very high load of Epstein-Barr virus, so that's 6. And we're pretty sure I have at least another species of Babesia. I may have other species of Bartonella as well. And complicating things is I'm on a corticosteroid right now, which reduces your IgG levels. And we know a lot of Lyme testing goes off IgG testing. So it's hard to rely on a positive IgG test, or I should say negative IgG test, because my IgGs may be low due to the steroids. So once the SOT goes in, like I said, the bugs will take up that RNA, they will stop replicating, and they will slowly die off. And the SOT is good for approximately 6 months in your system. The latest kind of research or anecdotal information I've seen from doctors that are practicing with SOT is that about the 3-month mark is when SOT is the most effective, and then it starts to decline a little bit. So how many SOTs do you need? It's not known. Some people do 1, and for Borrelia burgdorferi, and they are good, and they get well, and they are fine, and they go on their merry way. Other people need to treat 3, 4, 5 infections, and they do 2 for each, and they continue to, have to do, 1 a year, and they end up doing 8, 10, 12 SOTs. But they eventually get well, but it's really individualized, as everything with Lyme treatment is. So we kind of won't know until we get into it. There is also, there is a risk of having Herx reactions, because these are bugs that are dying off, and so they are going to release all their nasty substances as they're dying off. You think of like the Raid commercial, when you spray the Raid, and the bug is, screaming and, wriggling around on the floor. That stuff is going to get released. So detoxing is important in keeping things moving your detox pathways so that you herx as little as possible. But herxing is possible, but I've heard it's generally less than what would happen with antibiotics. So that is the procedure that we're going to undergo. The first one is in a couple of days. So we're going to be doing it for Borrelia garini and then Borrelia burgdorferi. Assuming I tolerate the Borrelia garini one okay, we'll do Borrelia burgdorferi in December, and then probably a Babesia one or a Bart early January, and then another, the other Babesia or Bart at the beginning of February. People ask about the cost, and generally the cost is anywhere from $1,800 to $3,000 per SOT. RGCC charges physicians roughly $1,500 to $1,600 per SOT. So, and really the only cost your doctor's office has is, the blood draw into the vials, shipping that to Greece, and then when it comes back, the cost of infusing it into you. So, a butterfly needle and a nurse for a few minutes, and then you sitting in their space and they watch you for a little bit. And also you get like a little steroid to help with your veins. Truthfully, my opinion, doctors shouldn't be charging anything more than, I would think, like $2,500 for this SOT, because they're making $1,000 markup on it. So I'm personally paying $2,500 at a lab or at a healthcare provider in Chicago. And I do know ones in Wisconsin that are charging roughly $1,900 to $2,600 per SOT. So that's roughly what it's costing in this area. I've heard stories of places charging $5,000 or $6,000 per SOT, and it must include something else. So please, if you're paying that, please clarify what it includes, because it should be including follow-up appointments and labs and things like that if somebody's charging that much. So, okay. So this is my first SOT video. So this is pre-SOT. I would say symptom-wise, with all my symptoms together, we're probably regularly at a 9.5 out of 10. I'm not on any IVs. I'm not in the hospital, but I'm in bed where I usually am, 80 to 90% of my day. I can't really get out of the house at all very much. If I do, I'm pretty much right back into bed when I get home. And I'm, daily functionally, I can dress myself and get a shower and make myself a light meal. But other than that, I'm really not doing chores or, taking walks or running errands or, doing anything like that. So, we shall see where we are in a month, and I'm probably going to do like an every month update. And hopefully this will be something that will be making me feel quite a bit better in the coming months. So let's hope.